A startling new report finds young Americans dying from suicide and homicide at the highest rates in decades. Here to answer questions is Dr. Khadijah Booth Watkins, a psychiatrist and the associate director of the Clay Center for Young Healthy Minds at Mass General Hospital. Dr. Booth Watkins, thanks for being here.
Doctor, it's always great to have you. Thanks for your time. So I'm going to put some stuff up on the screen. Let's take a look at it. This is new data from the CDC. For people between 10 and 24, the rate of suicide is now the highest on record and ranked second behind gun violence as the leading cause of death for this age group. Third on the list is homicide, with the highest rate of death since 1997. In other words, it was the last century. So what do you think is happening here?
Well, there's a lot going on, and I think there's a lot of factors going into this, and we can't really put it solely on the pandemic, because we do know that our young people were struggling with suicide and anxiety and depression. Those rates were on the rise prior to the pandemic. The kids are stressed out. They're overwhelmed. They're worried about their future. They're worried about the climate. The social and political unrest, well, it's pretty scary. And kids of color also have to carry the added burden of racism and discrimination. And we don't talk enough about how to restrict lethal means. We don't talk enough about mental health and what are the signs and symptoms so that people can intervene early before it becomes life-threatening.
Well, so there is this newish now national helpline for people in crisis. The number is 988. I say ish because some people still don't know about it, right? But it's been around a little while. So what do you want young people to know about the hotline?
Well, it's important to know that it is available for everybody. It's free and it's confidential. You'll get connected with a trained crisis worker, and they're there to listen to you, offer you support, and even give you some resources. And I think what kids should know, or young people should know, is that if you think you should call, then you should call, because they take all kinds of calls about different matters, and they're there to help and be a support. And really the goal is to put these matters in the hands of crisis workers as opposed to law enforcement, so that there's more support.
Doctor, that's wonderful. Can you say that again? If you think you should call, you should call. Remind everyone it's okay.
You should call.
Wonderful.
And it's okay.
That's
what they're there for.
That's what they're there for. Dr. Khadijah Booth Watkins, thanks for your time. Great to see you.
Thank you.
Thank you, doctor. So.